I started shared medical appointments back in 1999 when my boss had mentioned that he had just heard about another care model, and as a physician just out of training, I didn't realize how innovative it was because it just seemed natural to me that I wanted to spend more time and be able to convey more to my patients. Over the prior 8 years, I really enjoyed it. The patient response was tremendous, and so 5 years ago, we really looked at taking that to the next level and organizationally committing to offering shared medical appointments, which then took me into my current role as director of our program at the Cleveland Clinic.
The reason I started shared medical appointments was to match a clinical need for endocrine care, specifically in diabetes, with everything else the patient needs to deal with, primarily at home, which is nutrition, activity, blood glucose monitoring. And that's an essential part of long-term diabetes care, and not only for diabetes, but self-management support's important for many chronic illnesses. And I recognize that patients weren't able to get that.
Many of the times when it is one-on-one, it is only the doctor who talks to the patient, who gives the diagnosis, the treatment and prognosis. But once we could share the appointment with other patients, the patients were also individually talking to them. What happened to you? How do you remember your medicines? For example, in glaucoma, why is a good diabetic control important? So some questions they had very good answers from the peers, the patients as such. So these are few real benefits which we saw in our short-term experience.
There's been several benefits to introducing shared medical appointments. So one is the patients, and that's really foremost is the patient experience in all this. Having patients come to see the doctor more often is important, but I want them to be engaged and involved in their own health care. The second thing is just access to care. So I can normally see 10 or 12 patients in a morning. And that's because it's a very simple model of the medical assistant who does the vital signs and I'm doing the medical appointment. There's always challenges in implementing a new process or innovation, and we've had a number of those. When we first started the visits, they were 2 hours long, and we thought that they would be dynamic and engaging, and we were wrong. The patients clearly vocalized that they wanted something a little bit shorter. And our challenge is how to go back and kind of reinvent ourselves over and over again with every piece of the visit.
We had several challenges in implementing this new system. So we had a lot of meetings with our medical team. And I think the biggest challenge is to make them understand the concept and how it would benefit our patients.
There are many challenges with implementing anything new. There's a lot of unknowns, and so the challenge is how do you implement and get buy-in for a care model that folks haven't done before, may not be familiar with, and don't know how to implement. So I think the culture of change is really the biggest challenge to shared medical appointments. Your team is part of that challenge. They have to know what you're trying to accomplish. The physicians are worried about what's the patient's going to think? Is this the same quality of care? Am I going to be able to get the efficiencies that are marketed, or am I going to just have chaos because I really don't know how to manage a group of 10? And then patients. You have to make them understand what their appointment is, what the expectation is. And the themes that we see with hesitation to adopt change is I don't have the time to do it and I don't know how to do it. So if an organization was looking to start shared medical appointments, I would advise them to start small. Get the buy-in from a few champion physicians, develop the workflow, develop some experience with it.
I'm very optimistic seeing the practice in our system in a very short period. Both the medical team as well as the patients are very happy in the feedback which we got from them, except for the teething problems which we had. So I'm sure it has got a very bright future, not only in our system, but across the health system, wherever they're dealing with chronic diseases.
Our patient response has been absolutely positive. in appreciating that. And they often cite the extended time and amount of information as benefits that really resonate with why they attended in the first place.